All right, everybody. Hello. Dr. Rafich here from Vet Triage, Tuesday, October 29th, 2024, 1:04 p.m. Pacific time. We are going through this issue of JAVMA. This is the May 15, 2018 issue, and we are going through the what is your diagnosis? So this is a MRI case of a 4-month-old intact female domestic short-haired kitten that saw the vet for visual deficits, abnormal behavior, seizures, and learning deficits. And this is a T2 weighted MRI. T2 means that the fluid and inflammation, anything like that, will show up bright white. And so you can see there the more the white areas right there, like those areas on the MRI, that's all fluid. Information regarding litter mates was not available. Vaccines up to date. No travel history. Physical exam was normal, but the neurologic exam showed obtundation, blindness, and postural deficits in all 4 limbs. Postural means the ability for the body to sense where the foot or limb is in space. So when you walk as a human, you don't have to look down to see when your feet hit the ground. You just inherently know. That's the nervous system working, and that's what's called postural reactions. It's where your posture is in space. Clinical signs were consistent with diffuse cerebral disease. Blood work was normal. Bile acids normal. FeLV, FIV normal. Thoracic radiographs normal. And so we go on to the MRI. The MRI show that the lateral ventricles were enlarged. They had an irregular shape to them, continuous with a cavity extending caudally to the subarachnoid space and occipital bone, where the right occipital lobe had reduced volume. Left ventricle communicates with the cavity as well within the occipital lobe ventrally. And so here is the MRI again in more detail. You can see there all the little asterisks there. That's hydrocephalus, so dilation. The ventricle is dilated and irregular. The same as on the other side. It's just not as big on the left side. And this is a side view at the level of the midbrain, so mid-sagittal, parasagittal. And then same thing over here. You see how weird looking the ventricles are. So, and the arrow is shown over here. This arrow in this picture, the white arrow, is showing some maybe inflammation in the hippocampus on the left side. Diagnosis of hydrocephalus ex vacuo and bilateral porencephaly, congenital in origin, was diagnosed. They collected cerebrospinal fluid, so that's spinal fluid, via the cerebellomedullary cisternal puncture. That's right behind the skull. So they put a needle behind the skull under anesthesia and removed spinal fluid, which was normal. They started the cat on phenobarbital. And unfortunately, the kitten was euthanized a month later because of persistent seizures. They performed a necropsy, which showed dilated lateral and third ventricles aligned by flattened cuboidal epididymal cells. The subcortical white matter was thinned with degeneration, edema, vacuolated myelin, and axonal swellings. Let's go through that. Necropsy is autopsy. Dilated lateral and third ventricles. So the brain has 3 ventricles. The heart has 2 ventricles, right? That's the chambers of the heart. So the brain has three ventricles, and there's right lateral and left lateral, and they're shaped like this. And then when they conjoin in the center, they create a third ventricle, and then the mesencephalic aqueduct goes into the brain, and then that goes into the surrounding the spinal fluid. Spinal fluid surrounding the spinal cord. Then it says here that the ventricles were lined by flattened cuboidal epididymal cells. So ependymal cells are the cells that produce the cerebrospinous fluid. They produce the spinal fluid for the body. And then subcortical white matter. So the brain is made up of white and gray matter, and the spinal cord as well, white and gray matter. And it says here that with subcortical white matter was thin. So underneath the cortex of the brain, the white matter was thinned with degeneration. So it's degenerating. Edema, which is fluid buildup. Vacuolated myelin. Myelin is the material that surrounds nerves. It helps with nervous system conduction. And when it's vacuolated, it means there's cavities or holes in them. Axonal swelling is the axon is part of the nerve cell, and it's swollen. So this is their comments. Porencephaly is most consistently described as a focal congenital cystic or cavitary lesion within the cerebral hemisphere, which often communicates with the subarachnoid space or the lateral ventricles. This is infrequently reported in cats, and it's even more so uncommon in bilateral disease. The cavities result from fetal and perinatal brain destruction secondary to possible insults like ischemia, so like a blood clot, for example, or any damage to blood flow, and toxins. Feline panleukopenia as well can cause it. There was contrast enhancement. Contrast enhancement has been reported in the cavitations, but they're rare. Hydranencephaly is another form of congenital cerebral cavitation. The result of more global tissue loss results in almost complete absence of the hemisphere. And in these cases, the meninges as well as the lateral ventricles are intact, but the cortical tissue is replaced by fluid-filled sacs. And then hydrocephalus is defined as the enlargement of all or part of the ventricular system and can be described as communicating, obstructive, or ex vacuo. That's EX space VACUO. Communicating hydrocephalus is characterized by bilateral symmetrical ventricular dilation without any detectable lesions. Obstructive hydrocephalus is secondary to either partial or complete restriction of spinal fluid flow and may be associated with signs of increased intracranial pressure, such as flattening of the sulci. Sulci are the brain-like shape of the cavitations, the normal ups and downs of the brain cavity when you see on an MRI. So those could be flattened, or you'll have brain herniation, for example, transtentorial or transforaminal. All you have to know there at brain herniation is depending on the pattern of the herniation, we call them different names. Some are more severe than others. And then finally, hydrocephalus ex vacuo is a compensatory and CSF passively occupying a void left by primary tissue loss. So the idea here, because this cat has porencephaly, so tissue loss, brain tissue loss, the body then fills up that space with cerebrospinal fluid, and that looks like spinal fluid buildup in the ventricles, which is by definition hydrocephalus. Ex vacuo probably is Latin for like filling up the space that's empty. The exact relationship between porencephaly and hippocampal atrophy is unknown. So remember, we talked about in this MRI here, this one with the white arrow, you see the white right there, the white arrow, that's inflammation in the hippocampus. So it says here that the exact relationship between porencephaly and hippocampal atrophy is unknown. One proposed mechanism is ischemia due to damage to the middle cerebral artery and its branch, the rostral choroidal artery. Ratios of hippocampal symmetry and porencephaly cysts have been associated with seizures. Hippocampal volumetry has been used to identify atrophy and sclerosis of the hippocampus. In one study of epileptic dogs, they had a larger hippocampal asymmetry ratio than control dogs, but there was no correlation noted between ratio of the hippocampal volume and the seizure type, seizure severity, or the affected period of time. Hippocampal necrosis with secondary prolonged and repeated seizure activity cannot be excluded for the kitten in the previous report. The point is, if you have recent seizures, that can also cause cerebral edema, so inflammation in the brain. So it's hard to say whether or not that's why this kitten had that white area on the MRI. That was the arrow pointing to the hippocampus, or it's because of other causes of hippocampal necrosis. Ventriculomegaly, which is enlarged ventricles, and interhemispheric cysts have been reported in cats as an inherited neurologic syndrome. The interhemispheric cysts, however, are typically located at midline and associated with other midline structure defects, such as malformation of the corpus callosum, malformation of the interthalamic adhesion, and malformations of the septum pellucidum. Those are all other portions of the brain. Immune-mediated reaction to virally infected macrophages leads to granulomatous meningitis, ependymitis, and vasculitis. So granulomatous means an accumulation of macrophages, so mononuclear cells, and it typically indicates a chronic procedure. So scar tissue and fibrosis is often implicated with granulomatous disease. Meningitis is inflammation of the meninges. The meninges are made up of 3 layers, and they cover the brain and the spinal cord. Ependymitis is inflammation of the ependymal cells, or the cells we mentioned earlier that line the ventricles that produce spinal fluid. And then vasculitis is inflammation of the blood vessels. Finally, hydrocephalus caused by feline infectious peritonitis, or FIP, caused by feline panleukopenia virus. Feline infectious peritonitis is considered obstructive as spinal fluid is partially or completely impaired because of increased viscosity of the fluid, and it occludes the ventricular system. Hydrocephalus in the kitten here in this report was considered to be ex vacuo, which further rules out FIP as being the cause. So they're saying here that if you had just hydrocephalus and you didn't have the porencephaly in this kitten, then FIP would be a higher likelihood. But because you had the loss of brain tissue, then that's what was causing the hydrocephalus, and it probably was not infection. So, all right, that's it for this one. Nice short one. We'll see you guys again tomorrow. Thanks.